Joining us now, Dr. Christine Hoffman. Dr. Hoffman, great to have you with us.
Thank you, John. Thank you for having me this morning.
Dr. Hoffman, part of our network of medical professionals at the Job Creators Network, and one of our key members also very involved in the Job Creators Network health plan, healthcareforyou.com. Go to healthcareforyou.com. Dr. Hoffman, let's get to the op-ed that you did the other day. One of the reasons that I wanted to have you on, talking about voting safely, because I know, look, a lot of people are concerned. 60% of Democrats say they're not going to go and vote in person. They're afraid. They're voting by mail. If you do choose to early vote or vote in person, you said there's some precautions that you could take. Can you elaborate on that?
Absolutely, John. We recommend that people, if they're going to go vote in person, do the same precautions they do when they're going shopping or to a restaurant or, in groups of people, that you wear your mask and you safe distance by 6 feet apart.
And that's it?
Basically, that's it. I know at our voting booth, because I voted last week, exactly. When I voted last week, they had us put on a glove as well, but other places might not do that. But the basic tenets of being safe is distancing 6 feet apart and wearing a mask. It's that simple.
It is simple. I mean, when I early voted a couple of weeks ago, I live in Virginia. When I early voted, I early vote all the time because obviously I don't know where I'm going to be, the nature of my work on election day. I could be traveling or depending on where I'm going to have my anchor desk. So I like to get it done. So the only difference is I stood 6 feet back from someone and I had a mask on. No different than when I go to Food Line, Walmart, Kroger, the gas station. I mean, McDonald's. I mean, there was no difference. So
exactly.
Why this fear about voting?
They're just pushing fear-mongering to scare people away, and it is absolutely safe. There's a bioethicist, Zeke Emanuel, who served as a health advisor to the Obama administration, and he said voting in person is as safe as going to the grocery store, which we do on a weekly basis.
Look, what the Democrats have scared everybody into mail-in ballots, and I've been saying this since May, because with 60, 70 million mail-in ballots, they have an opportunity to engage in stealing elections, fraud, and everything else that you simply can't do when you vote in person. So it's part of their warped narrative. One of the things that you said in your op-ed, you said the new infection rate is slow to its lowest level in part because of herd immunity. The MIT Technology Review acknowledges that it's begun to act as a break in the spread of the disease. Yet, when you say herd immunity, the big tech companies will censor you, saying that that's false. There is no herd immunity. Also, now they're reporting that cases are going up again, and so that would appear to not be consistent with what you said in your op-ed. Can you expand on that for us?
Sure. At the time I was writing it, the bigger states where it was more infections had started to go down, and there are some states that it's going up as well, but more and more people are getting the disease, and as more people get it, then less people are going to come down with it because they've already been in contact with it. That's the herd immunity.
So basically, the herd immunity says if you get it once, you're not going to get it again. And of course, we know now 99.7% of people recover, and that percentage is even higher if you're under 65. We've also learned that out of the 220,000 coronavirus deaths, that only 6% of those, or 12,000, are actually caused by coronavirus only. But yet that's not reported in the news. All they keep telling you is about the bigger number. So where do we go from here?
We need to go to where we're living our lives again, because the majority of people, like you said, if you're under 65, they recover without any consequences. But there is a disproportionate number of people over that age group that do have consequences and tend to have a worse outcome or even die from it. But they usually have an underlying condition, and of course as we get older we have more underlying conditions. But the rest of us, the kids, need to get back in school, and we need to get out and vote. We need to go on with our lives because it is safe for the majority of us.
Dr. Hoffman, what is driving the fear?
I think it's false news that they're not reporting. Right from the beginning, all they kept reporting is, oh, another case, oh, another death. What about all the recoveries? I mean, they never reported, oh, we have this many recoveries. That drove me crazy, and when I pounded into my family and my friends and my patients, it's like, yes, we have all these people coming down with it, but we have even more people recovering from it.
It seems that a lot of us experience when we go out that if, I always have a mask on out of respect for other people. But occasionally, I'll go into the gas station or something and I'll simply forget it in the car, right? I just forget it. Well, the other day I went into the 7-Eleven, I'm pumping gas, and I go in for a bottle of water, and I had forgotten to put my mask on. And I open the door, and there's some lady with a big mask. And I mean, I thought she was going to hit me. She was like, oh, my God, you don't have a mask. Get away from me. Get away. And she starts screaming
in the
middle of 7-Eleven. Get away from me. Get away from me. It's like, and she was like maybe 25 to 30 years old, somewhere in there. I mean, certainly not a senior citizen. And I'm just like, hey, I'm sorry. I'll go get my mask. But how do people have that kind of an irrational fear over this?
Again, I think a lot of it is that they've not been taught. In actuality, you have to be in a small enclosed area with someone who's positive for 10 to 15 minutes before you're going to catch the infection. You're not going to get it by passing someone in the store. And they have studies that show that. And they even have reports of that. It's been published. But that's not what's getting released.
I've got a question here from Gene in Chesterfield, Virginia. He says, ask Dr. Hoffman, how much longer will nursing homes be on lockdown? Because it's really sad for so many of our seniors that are in rehab centers or nursing homes, and their family can't visit them except through an outside window.
It's up to the individual areas. I know here in Murfreesboro, they're actually probably about 2-3 weeks ago, they started letting the families come in contact with their loved ones again. So it is very sad and very disheartening, but it's up to the individual areas that are going to decide when they're going to allow that to happen.
So basically the states and the counties and the cities, wherever it is.
That or the individual nursing homes, too.
John Fredericks Radio Network. We're with Dr. Christine Hoffman, part of the Job Creators Network. And she's from the Memphis, Tennessee area. She's part of the Job Creators Network conglomerate that we have, small business owner, small doctor. Not a small doctor, but a small business owner, has her own practice. Dr. Hoffman, the Job Creators Network has put together a very comprehensive healthcare plan called Healthcare for You. You can go to healthcareforyou.com, healthcareforyou.com. A lot of talk now about pre-existing conditions. The Democrats were able to win a majority in the House on 2018 on one issue, Obamacare, and the Republicans trying to underpin it. Now they're trying to do the same thing in 2020. What is it about the plan that you guys have signed on to, the plan that I just mentioned? Go to healthcareforyou.com. How does that plan protect people from losing coverage if they have a pre-existing condition?
President Trump's plan also goes along with our plan as well, and his plan he's already signed an executive order to protect pre-existing conditions, and he's emphatically stated that he would veto any health care bill that does not cover pre-existing conditions. His plan is something that's going to repair, restore, and improve the patient-doctor relationship and remove the bureaucrats and politicians from the exam room and increase choice and affordability. Biden's plan will not. Biden's plan is on a way for Medicare for all.
And so Medicare for all, though, seems to be gaining national backing. I mean, you look at the poll numbers, more and more people say the public option is a good thing, Medicare for all is a good thing, even though what they don't tell you is there's 200 million people on private insurance that would be gone under Medicaid for all. But a lot of people say, why not have the public option, which means that if I feel like going on it, I pay a little bit, or I pay whatever it is to have it cost neutral to the government, and I get to take advantage of that. Why is that a bad idea, doctor?
Personalized health care gives you better care, more choice, and lower costs. It puts you in charge of your health care, your doctor, and your wallet. And is a stark contrast to the high-cost, restrictive Affordable Care Act, which is just a stop on the way to the Medicare for all.
under Medicare for All, if you have the public option, give our listeners, Dr. Hoffman, a sense of what percentage of an actual doctor's bill or hospital bill, what's an average percent that Medicare actually pays?
About 60.
Okay. So here's the problem with the public option. Right now, the other 40% is being subsidized by everybody else, right? But the only people that are on Medicaid are the aged over 66 or those that have become eligible through various lower income incentives. If you open this up to a public option and you pay just a little bit and the system becomes overwhelmed, that is going to substantially increase the number of people on Medicaid who are paying only 60% of the bill. What does that do for everybody else?
It puts them in to be responsible to pay for it because it's got to come from somewhere.
Right. So everybody that chooses the public option, somebody else has got to pay for that.
That's right.
And so as the private pool dwindles, that's why the public option is simply a down payment on Medicare for All, because as people choose the public option, the system itself collapses, and then you have to have a single payer system, and now you've got nationalized medicine. I mean, it can't go anywhere else.
That's right. That's right. I mean, that's what's happened to the Affordable Care Act. Our first year of joining it, we were paying $690 for our family. The second year, it went up to $900. The third year, they wanted it to go up to over $1,200, and that's when we dropped it. I mean, that was more than my house payment and my car payment and my taxes all put together. It's just unaffordable. It's not sustainable. It collapsed on itself.
And then, so when you opted out of it, what did you end up having to do for your family?
We did one of the ministry sharing groups, which was much more affordable.
That's exactly what I've done. I've done Liberty Health Share forever for that reason. And now the problem you have is when you got rid of the mandate, now many people are going uninsured. So you actually look at the uninsured numbers; they're higher now. The purpose, this is the irony of it. The purpose of Obamacare was to get rid of so many people that were not insured at all, right? That was the objective of it. All these people aren't insured. They go to the emergency room. They get care. We pay for it. So they were going to end that with a mandate. What's happened today, when it's all said and done, a higher percentage now of people don't have any insurance than before Obamacare. So it actually had the opposite effect.
That's right.
Unbelievable. Why hasn't this plan been embraced by Republicans as a national platform?
It's gaining support, which is what we needed to do, and shows like yours that help educate people are what are needed. And like you said, pushing the Affordable Care Act promised Americans they could keep their doctor in their plan, but that didn't happen. Over 4 million people lost their insurance, and premiums more than doubled, and deductibles are sky high. It's crazy.
Yeah, it doesn't make any sense. It has absolutely failed. Dr. Christine Hoffman, I want to thank you for being with us. More information, go to healthcareforyou.com, healthcareforyou.com. Dr. Hoffman, thanks for being with us today.
Thank you for having me.
You.